When we talk about blood sugar management, especially in the context of diabetes, most conversations revolve around familiar pillars: nutrition, physical activity, medication adherence, and routine monitoring. These factors are critical and rightly emphasized. However, what is often overlooked and yet quietly influential is the environment in which we live, specifically the weather. Today, I would like to draw your attention to a less obvious but scientifically significant factor affecting blood glucose levels: temperature and seasonal weather changes. Endocrinology experts, including Komal Patil-Sisodia and Rachel Pasapalak, have highlighted compelling evidence that both hot and cold weather can meaningfully disrupt glucose regulation. Understanding this relationship is not merely academic, it is essential for improving year-round diabetes management and preventing long-term complications. To appreciate how weather influences blood sugar, we must first understand what happens during a blood sugar spike. A spike occurs when glucose levels rise beyond what the body can effectively process. This may happen because insulin is not produced in sufficient quantities, insulin action is impaired, or because excess glucose is released into the bloodstream. While occasional fluctuations are normal, frequent or sustained spikes increase the risk of serious complications, including cardiovascular disease, nerve damage, kidney failure, and vision loss. Therefore, identifying all contributors to blood sugar variability, including environmental ones, is a vital component of comprehensive care. Cold weather places unique physiological demands on the human body. When temperatures drop, the body activates a stress response designed to preserve core heat and maintain survival. One consequence of this response is the release of stress hormones, such as cortisol and adrenaline. These hormones reduce insulin secretion and increase glucose release from stored reserves, leading to elevated blood sugar levels. According to Dr. Pasapalak, cold temperatures also lower skin temperature, which slows the absorption of injected insulin. This means insulin may take longer to act, potentially resulting in higher than expected glucose readings. Paradoxically, cold weather can also increase the risk of hypoglycemia, particularly in individuals with type 2 diabetes, and even in people without diabetes. This occurs because the body burns more glucose to generate heat. When energy expenditure rises without adequate nutritional compensation, blood sugar may fall too low. Compounding the problem, cold-induced symptoms such as numbness, shivering, or feeling unusually cold can mask the warning signs of low blood sugar, delaying recognition and treatment. Weather influences not only our physiology but also our behavior. During colder months, people tend to exercise less, spend more time indoors, and consume higher calorie, carbohydrate-rich comfort foods. These lifestyle shifts reduce insulin sensitivity and promote glucose elevation. As Dr. Patil-Sisodia notes, decreased physical activity directly impacts the body's ability to utilize insulin efficiently. Over time, this combination of reduced movement and dietary changes can significantly destabilize blood sugar control during winter. While cold weather presents its own risks, extreme heat introduces an entirely different set of challenges. Research and clinical observations confirm that hot temperatures can raise fasting glucose levels and increase variability throughout the day. One of the most significant contributors is dehydration. The Centers for Disease Control and Prevention have emphasized that dehydration can artificially elevate blood sugar readings by concentrating glucose in the bloodstream. People with diabetes are particularly vulnerable, as high blood sugar itself promotes fluid loss through increased urination. Furthermore, diabetes-related nerve or blood vessel damage may impair the body's natural cooling mechanisms, making it harder to regulate temperature and fluid balance during heat exposure. Heat does not only affect hydration, it also alters how insulin behaves in the body. Warmer temperatures can accelerate insulin absorption after injection, causing it to act more quickly than expected. This unpredictability may lead to sudden drops in blood sugar, especially if insulin doses are not adjusted. There is also the issue of insulin storage. insulin exposed to high temperatures may degrade, losing potency and effectiveness. This can result in unexplained hyperglycemia, even when patients adhere to their prescribed dosing schedules. Given the variability introduced by weather, both experts emphasize that frequent and consistent glucose monitoring is essential. This includes traditional fingerstick testing as well as continuous glucose monitoring systems. Regular monitoring helps individuals identify personal patterns and recognize how their bodies respond to temperature changes. Importantly, the effects of weather are not uniform. What causes hyperglycemia in one person may lead to hypoglycemia in another. Technology empowers patients to move from reactive management to proactive prevention, adjusting activity, hydration, and medication before dangerous fluctuations occur. During colder months, maintaining physical activity is paramount. When outdoor exercise is not feasible, indoor workouts such as resistance training, yoga, or treadmill walking help preserve insulin sensitivity. Wearing warm layers also plays a physiological role. By keeping the body adequately insulated, individuals can reduce the stress response associated with cold exposure, minimizing hormone-driven glucose release. For those using insulin, it is critical to protect supplies from freezing temperatures and to be aware that glucose meters may produce inaccurate readings in extreme cold. In hot conditions, hydration becomes a cornerstone of blood sugar control. Drinking water consistently throughout the day helps maintain normal glucose concentrations and supports thermoregulation. Beverages that can destabilize blood sugar, such as alcohol, sugary drinks, or energy drinks, should be avoided or consumed with caution. Staying cool through shaded environments, air conditioning, and appropriate clothing reduces physiological stress. For insulin users, proper storage away from heat sources is essential to preserve medication effectiveness. The most important takeaway from this discussion is that blood sugar management is not static. It must adapt to changing conditions, including the environment. Weather is not a minor background factor. It is an active variable influencing hormones, behavior, medication performance, and hydration status. By recognizing weather as a legitimate component of glucose variability, patients and healthcare providers can develop more resilient, individualized management strategies. In closing, blood sugar control extends far beyond the plate, the pill bottle, or the gym. It is shaped by the seasons, the climate, and the temperatures we experience every day. Cold weather can trigger stress responses, alter insulin absorption, and mask hypoglycemia. Hot weather can cause dehydration, accelerate insulin action, and degrade essential medications. The insights shared by endocrinology experts reinforce a critical message: awareness is prevention. By understanding how weather affects blood sugar and by adjusting monitoring, activity, hydration, and medication storage accordingly, individuals with diabetes can protect their health throughout the year. As we continue advancing diabetes education and care, let us broaden the conversation to include the environment itself, because sometimes the most influential factors are the ones we feel, not the ones we eat.